We are now recording. So hello, everybody. This is Krista Rutledge, Chief Development Officer at Friendship Place, and I am so excited to be here the day before Veterans Day, having the opportunity to speak to members from our Veterans First team and hear about the work that they're doing. We are recording this, so we'll have this for future reference for people to speak. In the meanwhile, what I'm going to do is now turn the floor over to Jean-Michel Giraud, who is our President and CEO, and he'll introduce Emily and Jonathan from the team to talk about the work that they are doing. So let me turn it over. Jean-Michel, it should be over to you. I think you should be unmuted.
Yes, good afternoon, everybody, and thank you for joining us. Thank you for your support. We appreciate it. We are fortunate to have two leaders from our Veterans Services Division with us today, Emily Carpenter, the Division Director, and Jonathan Whitted, the Assistant Director. Some of you already know that we started veterans programming in 2011. We started very small with one position that first year and then went to the regions level right the next year on our own with a grant directly from the Department of Veterans Affairs. The division you will hear focuses mostly on rapid rehousing, and all it encompasses, of course. And then there is this new shallow subsidy program that you'll hear about. And a lot of news from just this year, because the Department of Veterans Affairs has a true commitment to making sure that veterans are safe and get rehoused properly. And we have received a lot of extra support, which is really great during the pandemic. A little bit about our partnership with the department. It's been an excellent partnership. I have been really impressed being a rehab person with the way the model was researched by Dennis Culhane at the University of Pennsylvania and his team to start based on rehab values, based on empowerment, with all the right pieces in there. So it was really exciting to see that when we joined, but also dealing with the leadership like John Kuhn, who runs the program at the national level, how accessible these folks are, how supportive they also are at the regional level. And, you know, as I monitor the program and its growth year after year, adding pieces that fit, really targeted again, with truly at heart and in people's minds at VA, the welfare of our veterans. So with no further ado, I'm going to turn this over to Emily and Jonathan. Emily, you're muted.
All right, sorry about that. Great, so thank you so much for having us. So I'll start off and then Jonathan will jump in to talk about more of our specialized services. So as JM mentioned, we are a rapid rehousing program mostly. So we work with veterans throughout the DC metro area. So DC and then the 8 surrounding counties, 5 in Virginia, 3 in Maryland. As he said, we started as a staff of 1 and we're now a staff of 31 and growing even more. So have definitely had some pretty amazing growth over the years. And it's been really, I've been with the program for almost 8 years now. So it's been pretty incredible to see it grow and see it evolve. So our focus really is making sure that veterans are able to be safe and stable in permanent housing. And now more than ever, that is so important, and we're seeing kind of how the pandemic has really impacted the folks that we serve this year. We do rapid rehousing services, which means that we work with veterans who are literally homeless and get them into permanent housing. And we also have been doing some homeless prevention services, so preventing folks that are either doubled up or facing rental arrears on entering the homeless system, whether that's by paying for some of those arrears or it might be helping them find their own housing or helping them reconnect with family and friends. So we, last year we served 604 households, which is a total of 772 people. So it was pretty incredible work on behalf of my team. We served more than we were projected to serve, and I'm really proud of the work that they did. About 88% of our households exited to permanent housing as well. So nationally, it's about 75%. So again, doing good work through our team members. COVID-19 has obviously dramatically impacted the services that we're providing. And kind of as a response to that, the VA has really encouraged us to help veterans get out of congregate settings and get into safe settings. And so while our goal is always to get veterans into permanent housing, as you all can imagine, I'm sure that can take some time. And so while we're working with veterans on that permanent housing plan, we've been able to put a lot of veterans into hotels so that they are not staying in shelter or in transitional housing. The VA estimates that about 75% of the veterans served by SSVF as a whole have health factors that could make COVID-19 even more complicated. And so starting in March, there was a huge push to get a lot of the veterans that we served out of those congregate or unsheltered settings into what they call emergency housing assistance. So that is something new this year. We haven't really done that much in the past, but we had about 100 people in hotels, and so far out of those we've housed about 40 of them. So we're working on getting people into permanent housing, but we've definitely kind of expanded our services that way. Something else that has come up kind of as a result of the pandemic is a lot of people were relying on transitional housing for meals, as well as for some of the other social service providers in the city for meals, and kind of that has dramatically changed. So we've also been able to expand food assistance for the veterans that we're serving kind of in hotels as well as in permanent housing locations. Let's see. And so we received a significant amount of additional funding through CARES funding in order to support this work. And so that's kind of how we've been able to assist more people with those hotel stays. One of the interventions that Jean-Michel mentioned before was shallow subsidy. So that was a really exciting addition that we had to our suite of services for fiscal year 20. And so in addition to the rapid rehousing and homelessness prevention services, the VA recognized that, a lot of the people that are served especially in the higher cost of living areas, DC being one of them, that this program is excellent at helping end homelessness, but it was not doing enough to help end poverty. And so the shallow subsidy intervention has been really helpful in that. And so what that is we're able to take people, initially it was just DC. We're really excited that it just was able to get expanded a bit more on this fiscal year. So we are expanding it. But last year it was taking just DC folks who were in housing and were able to pay 35% of either fair market rent or rent reasonableness in order to help over a longer period of time, and really focused on connecting people with jobs and with senior living or kind of whatever support that they might need to be able to be stable. So we were one of nine areas selected to do that. And so we are seeing that this is going to be really helpful for people in achieving longer term stability. So we've been partnering really well with employment programs for that. And another thing that's really great is that once someone is in shallow subsidy, they don't have to be recertified again. So there's no disincentive to increasing income. And we're really anticipating that to be a great intervention this year. Like I said, we are expanding it. The VA was able to get that authorized, so we'll be able to expand that to Prince George's, Montgomery, Fairfax, and Prince William counties this year. So I think that will definitely be a great addition. We saw it being really effective, but kind of as a result of COVID, a lot of people's income structures changed dramatically. So it wasn't utilized as much last year, but we've already seen a significant amount of referrals this year. Just to give you kind of a sense of the household composition of people that we serve, this past fiscal year, 83% of the households we served were at or below 30% of the area median income, which is about $26,000. So that's why we really think that the shallow subsidy intervention will be really useful for people that are kind of living on the margins in helping achieve that stability. Another exciting addition to our program with this fiscal year that also came as a result of CARES funding is we're hiring a healthcare navigator position. So kind of as more people have gone into hotels, we're able to actually serve people that previously had not wanted to go into shelter or transitional housing, and who had been kind of on the margins and not really touched by as many outreach contacts as we hoped. And so a lot of those people are now coming into hotels and accessing services, but kind of identifying a large amount of healthcare needs. So kind of this position is intended to help kind of meet those needs and help people navigate those services. So we're really excited to bring that on. That is going to be a national effort, so kind of across the board. There will be healthcare navigators throughout all where SSVF serves to really help people navigate those challenges. Even though kind of a lot of our services right now are still provided remotely, so we are doing some field work, but for the most part it's remote, both to help support staff, but also to help protect participants. But kind of something that we've been able to do as a result of VA funding expansion is we've been able to get participants phones so that they can engage with case management as well as a lot of their medical appointments, because telehealth is still a major thing. And we keep housing people. So I think that is what we do best. That is what we were built on. We have focused really hard on rapid rehousing. And so even in the midst of a pandemic, we're still able to get people connected with landlords. We're able to do, sometimes we're doing like virtual walkthroughs with veterans so that they can make sure that they really want that unit before they go out and sign all the paperwork and things like that. But we're still housing people through landlord partnerships. And Jonathan will talk a bit about kind of our housing specialist and how she's navigating that. And I think that kind of like at the end of the day, you know, this services have totally changed, but kind of our core mission, which is housing people and making sure that people are really involved in their service plans. And so, you know, we're never placing someone into housing. We work with them to find housing that meets their needs. And sometimes that takes a bit more time, but we're patient and we work with people to really kind of help build them up and make sure that the unit that they find is a unit that meets their needs. Something that I think we're always looking for additional funding for and looking for private funding for specifically is a way to make a house a home. And so under VA services, we're able to purchase a bed for someone, but that's it in terms of furniture. And so something that we've really struggled with and we're still working on building those partnerships is making sure that people have the furniture that they need in order to really kind of thrive in their housing and make it feel like a great place for them to stay. And one other, so we do rely on private funding for things like that. And one quick story that we had recently is we had a participant who was a DoorDash delivery person. And so he used his bicycle to work, and his bike was stolen. But we were able to utilize some private funding to make sure that he was able to get a new bike, which is surprisingly challenging right now. Bikes are a hot commodity. But we were able to locate a bike for him. So he was able to get back to work and keep maintaining his housing and keep maintaining his income for his family. And so, you know, I think that our services have changed, but we are adapting, and we're working with our teams to make sure that we're still meeting veteran needs. And I'm going to turn it over to John to kind of talk more about the specialist team and kind of how they're supporting our participants.
Hi, everyone. I'm Jonathan. I want to echo kind of what Emily said earlier about thanking you all for allowing us to come in and talk to you a little bit about our services and what we're doing during the pandemic. As Emily mentioned, we have an outreach specialist team that their function is to support the team and the case managers and some of the things that our participants may need that case managers that wouldn't be able to do all by themselves, like something that they could actually help them kind of accomplish the goals of like either getting employment, getting connected with resources, actually, you know, being able to engage with participants out in the community and in our shelters, things like that. And of course, during the pandemic, we've definitely seen like a need to get creative in how we do a lot of these services that we normally do. I just want to talk to you a little bit about like kind of like what the specialist roles are, and then like kind of what they've been doing since the pandemic started. So we do have an outreach team. Usually their main function is to kind of going out into finding a lot of individuals that need the services that we provide. So going to the shelters, accessing our screening line, kind of hearing out what are the needs of the people in the community who are either in danger of losing housing, or individuals who are literally homeless. And then once you're engaging them, kind of building those relationships, seeing what their needs are, and seeing if they need to be connected with certain resources in the community, and if they are eligible, can they be screened into being set with a case manager for intake. And as of since the pandemic started, obviously that their job has been quite difficult because, you know, we are working remotely. So most of it has been through, you know, electronic means. So, or, you know, basically being able to access that screening line, as I mentioned, when people call in, kind of reaching back out to them, seeing what their needs are. I think that they've been doing an excellent job with this. We have seen that we've been connecting with the continuum of care and community partners in order to see if there's any individuals who may not have access to call our screening line, and if there's a way where we can connect with those community partners to be able to get like an outreach specialist to kind of contact them through various means. As Emily mentioned before, we've been helping individuals who are in congregate settings get into emergency housing, so into hotels. Our outreach team has been doing an excellent job with that. They've been, once again, like connecting with the VA and the COC in order to see who are the most vulnerable individuals who are in these congregate settings, and then helping those individuals get connected with a case manager. And then also helping the community partners who may have direct contact with those individuals and how they can get documents together faster, how they can get documentation completed quicker, so they can, you know, easily get into services that way. I also think that our outreach team has done a great job with, you know, connecting with our case managers and helping them understand the needs of those participants, and trying to see how much they can do on the back end before they get with a case manager as well. Another role that we have on staff is our benefits specialist. This person connects people with SOAR. They also do a good job of connecting them with VA benefits that someone may or may not know of, or may be having difficulty getting connected with those resources. This person has done a really good job during this time too as well, because I think that with the pandemic, we also saw there was a lot of need for individuals needing to get connected with unemployment. And she really transformed her role a lot in order to see a lot of those community resources that she normally doesn't deal with. How can I get this person connected with these things? And she really you know, worked to study on like the unemployment laws at this point through all the different jurisdictions that we serve, and seeing how people can easily access a way to apply for these unemployment benefits. And I think that that's been big. She's also done a really good job in finding food resources, because that was something that was really difficult this time, especially with individuals who are losing employment, not able to pay for food. A lot of pantries, some were not in service anymore. So just kind of figuring out what are things that participants could be missing out on that is a need at this time. We also have an employment specialist, and our employment specialist normally would not during the pandemic would have job fairs that they could have employers come to, have our participants get direct access to those employers, and actually have like on the spot hiring. This has been something that we couldn't really have those job fairs anymore, but our employment specialist has still been connecting with employers and seeing like what are they doing at this time and seeing how they can connect our participants with these employers. And then also with the need for doing resume writing or needing to know what employers to contact or what other like employment resources there could be. We've had case managers who need someone who's always engaging and always like vetting like new employers to like work with our participants, and our employment specialists have been able to fill in that role to do that. So that's been pretty big. And I will say, like, even during this pandemic, we actually our goal is to see 80 veterans in a fiscal year get employment. We actually made it to 84. So even through the pandemic, I see like there's been a great push in order to make sure that, you know, individuals, not only when they're getting housing but also how can they sustain housing, and employment is a key in that. In our last role that we have in the employment team, the specialist team, is the housing specialist. So this person is always engaged in like finding new landlords, finding new units for the case management team and the participants. Some individuals have a lot of barriers in order to get to housing, whether poor credit. They have a lot of evictions on their record. We house a lot of individuals with zero income, things of that nature. So the housing specialist really does a great job of researching and kind of digging to find, you know, landlords that are willing to work with our program and willing to overlook some of these barriers. She had the goal of, you know, we always have the goal of having like, you know, a certain set of like new landlords that we can kind of use, and a certain like available units that we can use throughout the fiscal year. And it was 80 landlords and 160 units. That was the goal. We got to 90 landlords and 414 units. So that was amazing. And she works tirelessly to make things like this happen. And not only that, she went out of her way to learn a lot of the landlord tenant laws too as well, just so she could tell the rest of the team and spread that information so we could better, you know, help our participants during this time. We've had, you know, certain landlords that, you know, during the pandemic, even though you're not able to evict, they still try to take advantage of participants and try to, you know, say that they're not able to access their homes anymore, or try to do something else that's illegal. I think one time me and Emily saw, I want to say over the summer, that someone was trying to charge a late fee that was astronomical. So knowing the laws is so important, and being able to support the participants through that and telling them ways to how they can protect themselves is very important. And I really appreciated that the housing specialist took the time to kind of, you know, be up on like the different laws that are happening right now. So yeah, we have a very good team that's really got creative during this time, and really have worked hard to kind of figure out what are the needs of the case managers and the participants, and how are ways that we can say yes, even during this challenging time. So yeah, I really have been excited about the things that they've been doing.
Well, both of you, thank you. That was amazing, and so much great information. And it sounds like you're doing such great work and such meaningful work for folks who most definitely need it and who've served to this country. And so it behooves us to make sure we serve them in return. I wanted to introduce one person, Daria Totanico of PenFed. We talk about the connection that we have with private funders, and PenFed Foundation has actually been a funder of ours. I don't know if you want to say a few words to say hello, Daria, and introduce yourself.
Sure. Thank you so much, Chris. And I wanted to just echo thanking Emily and Jonathan for their updates. the PenFed Foundation. I'm Derek Tonic. I'm the director of programs at PenFed Foundation. Friendship Place is a very crucial, important partner for us. The vision and the mission of the PenFed Foundation is that military service members and veterans in their communities have the skills and resources to realize financial stability and opportunity. And our vision is that all veterans have a strong financial future. So reducing and preventing homelessness among the veteran population is a really crucial priority for the foundation. And we do that work through important partnerships like with Friendship Place. So I am just really honestly in awe of the work that you do and how you help so many people, and your focus and unwavering focus to get homeless veterans into permanent housing. And it sounds like, well, of course, isn't that obvious? But as you know better than I, having done this for your careers, it's not. So we're very honored to be able to support the great work you do. So thank you, Chris. I appreciate being part of today's webinar.
No, thank you for all that you do. As I mentioned at the beginning, if you have any questions, please drop them into the chat and I will ask them. Perhaps I'll even unmute a little bit later if we get this way. But I'll try to keep folks muted this way. It's a little more quiet as we go through. I know I have a couple of questions, Emily and Jonathan, if you don't mind answering. I guess in terms of picture of who we're serving through the Veterans Program, are these folks who've generally served in active war zones, or have they served in other ways? Is there any general way that any general picture of the vets we're serving that comes through there?
So right now, I pulled the data right before this call, actually. So right now, our average age of person served right now is 54 years old. So in general, we are seeing a lot of veterans who didn't necessarily serve in conflict, but served in other ways. I will say the more that we do prevention services, we tend to see a younger demographic there. So less folks that have entered the system, but more, we do generally see more families, and we generally see younger veterans.
Right. Are we seeing folks coming with injuries and disabilities from their service?
Go for it, John.
Yeah, I was going to say that's something that, I guess we don't necessarily ask a lot of questions about different disabilities. So you could have individuals with PTSD, which is something you can't really see. We definitely have had individuals with different disabilities, but I don't know if there's anything where, we've definitely collected data on, how many individuals that we work with have disabilities versus don't.
We do. We try to be very person-centered in the services that we provide. And so we do have veterans who come with a service-connected disability, which means that they receive some sort of compensation or rating based off of an injury from their time in service. But we do kind of defer to the veteran on whether or not they want to disclose information to us and try not to re-traumatize. So it might be over the course of time that we do learn more about various disabilities, but they don't have to disclose it to receive services from us.
We have a question in the chat from Nikki. She'd like to speak with the housing specialist that Jonathan was speaking of. She's the social services coordinator at Heaton House Apartments in Ward 5, and they have a vacancy. Nikki, if you want to unmute yourself and talk a little bit about what your services or what what you do, and then we if you want to unmute yourself.
Okay. Can you hear me?
We can.
Okay, great. Yes. So my name is Nikki Wiles, and I am the social services coordinator at Heaton House Apartments. We're at 2900 Newton Street, Northeast, Ward 5. We're right off of Rhode Island Avenue, Northeast. We're like 2 blocks away from the Maryland D.C. line going into Mount Rainier, Maryland. This is an apartment community for senior citizens, 62 and older, and persons with both physical and mental disabilities. That's the only requirement that we to gain entry into this community. I've been reaching out to the veterans organizations, advertising this unit. And I think because maybe of COVID, I haven't really gotten any responses. But we would love to have veterans here. we don't have any now, and we would love to have some.
Great. We will definitely get you in contact with Kara. Do you mind? I don't know if there's a way for you to send your email address or number
Yes,
like directly to one of us, or you
can
can
do
put
it
it in the
now.
chat if you're comfortable.
And I think I have it as well, so I could forward it on to you.
Okay.
But yeah, we'll make sure we make that connection. That's wonderful. Well, let's see. This is wonderful. We've made a connection. That's fantastic.
We're always looking for housing, so we definitely appreciate it.
Yeah, and this is a very quiet community. So, you know, I think that this is the perfect environment for veterans. It's very quiet. It's a very close-knit community. We enforce the rules. We've just undergone renovations, so the apartments are brand spanking new. The apartment is 366 square feet, so it's small, but you know, it's big enough for one person. It's very cozy. The rent is $1,200 per month. All utilities are included, but we do accept vouchers. I saw that Jonathan mentioned that there are obstacles that the veterans may have, like poor credit, multiple evictions. The company, I think, will work with that. So our property manager and Securities Property Residential, which is based in Seattle, Washington, which is the company that owns the community. You know, I'm sure you can, you know, make some exceptions.
Okay, great. I'll definitely get Kara to reach out to you.
Fantastic. And Emily, I just emailed you the information that Nikki had dropped in the chat. So multimedia.
and I also created a Pinterest board for my community, and I have a Pinterest board for veterans, all veteran services that I found for the DC area. So I've been sending out information to them about our community.
That's really creative. I love it.
Yeah.
Fantastic. Thank you.
That's fantastic. We have another question in the chat. How much of the housing that we locate is in DC as opposed to Maryland and Virginia?
Oh, I can actually tell you that. Let me pull up.
I will say, while Jonathan's pulling that up, the majority of the folks that we serve are in DC. Prince George's County is our second largest. Fairfax and Prince William kind of tie for third largest in terms of people that we're serving. And for that reason, we do have a satellite office in Greenbelt and in Alexandria, so that we can better reach those that in the other counties.
And so go ahead, Jonathan. Sorry.
Oh, sorry about that. I was going to say, out of the number that I told you before, like the 90 landlords, like 40 of them were DC, and out of the 414 available units, 236 were in DC.
Okay, great. And
we really use the veterans' preferences to kind of guide where we're looking for housing. A lot of people are experiencing homelessness in DC because that is because our shelter system is easier to access, but also the only the majority of the VA transitional housing beds are in DC. And so even if you're from Maryland, you might be placed in a transitional housing bed in DC by the VA. And so we definitely have people that want to live in DC, but we also have a lot of people that want to live outside of it and kind of use them as our guide for where we're targeting.
Do you want to add anything about our satellite offices in Maryland and Virginia and the work they do and how many people they see?
Sure, yeah. So in Maryland, we have about 7 case managers based out of our Maryland office and 4 based out of our Virginia office. All of our staff serve DC participants. So kind of regardless of where you're based, you always serve DC. And then we break out case managers have different coverage areas within the counties so that they can really become an expert in the counties that they serve.
Very good. Next question we have in the chat there. First, Jeff is saying, thank you for the webinar. I'm glad you appreciate. What is the intake process for a new participant? And more specifically, if he or any one of us meets someone who's a homeless vet, what's the first step, or do we contact Friendship Place? Do they go through the VA first? What's the process on that?
Yeah, so if there is individuals that are experiencing homelessness right now or in danger of being homeless, you would just contact us. So we do have a screening line, and in the screening line, I think Emily's you want to type it in?
Mhm.
So she's going to put the number there, but that is the line to be able to leave information. So then that way, outreach specialists can then call them back or call whomever may be easiest to get in contact with the veteran. And then from there, then they do a screening form with them over the phone, just to see if they're eligible for services. And if they are, then they connect them with an appointment time with a case manager. And then this case manager will then meet with them and go over like the intake paperwork with them. So it'll just kind of questions that will dig a little deeper into like kind of their needs and also into like eligibility and stuff like that. And then from there, they'll be able to kind of like set like a 90-day stability plan with them, figure out like kind of what are like the current needs that they want them get to housing and be able to maintain that housing. And just working with them there. And Emily said it before, like it's very like participant centered. So it's kind of, where do you see yourself, wanting to live, what is stable for you? What are the things you think is gonna, help you either find housing or maintain it? Just things like that, because obviously, like if you're trying to dictate, what the needs are for the person, it's that's just not going to work, and it's not the right way to do services.
That's good.
And just kind of base our basic eligibility, I should have led with that. So we are, to receive services from us, the VA requires that you have served active duty with an other than dishonorable discharge. So we can serve people, more people than the VA can serve, actually. You have to be below 50% the area median income, which is dependent on your household size. And then you also need to either be literally homeless or at imminent risk of becoming homeless, which means that you will become homeless within the next 30 days.
Okay. In terms of capacity, can we take anyone who's coming at this point? I mean, how close are we to full?
So it's kind of an ever-moving target. So we are a short-term program. We're not here forever, although our services have our service time right now has increased a lot because some of our restrictions have been lifted right now with the Stafford Act and the emergency declaration. We are exiting people who are stable. So it's kind of an ever-moving target. We do have some openings. There are times where we have a ton of openings, and we don't have a ton right now, but we are working on helping with caseloads. And also, that should never prevent someone from reaching out to us. We work really closely with the other SSVF providers in the area. We're not the only one, and so kind of always have an idea of who has openings or not, and we can do a warranty if we can't take on the case.
And just to add on to that, like we've been able to connect people with other resources if we're not able to work with them for whatever reason, or be able to kind of do some like planning to kind of figure out like what is a way we can still help this individual or this family, even though we may not be able to roll them right now. I actually helped a family the other week where they weren't able to enroll with us, but I was able to still work with them to find housing. So it was like something where it's like we're still going to work to help you find something and to kind of get you to the place you need to be.
And I will just jump in and add on to that. That's also where some of our private funding can be really useful. So we might be seeing a veteran who might have a very unique need that doesn't need the full suite of SSVF services, but might need just like a quick check cut to meet a need. On average, our average amount of private funds that we spend per household is about $500, and it dramatically impacts someone's life. And so I think we've had veterans come to us who might just need a security deposit to move into a place, but they've gotten one from SSVF in the past 2 years, so they're not eligible. And so just kind of a quick check of their security deposit can mean that they can exit homelessness and move into safe housing. And then often they're able to maintain it. But it's very hard to come up with all the funds needed at move-in. It's incredibly expensive.
And you had mentioned it does seem like all of the various service providers do work closely together? And do you get together and talk about needs, and how do you all work together on a regular basis?
Yeah, so we've served DC and then the 8 surrounding counties, and so each county has their own system. Jonathan mentions DOCs, so they each have their own continuum of care. In DC, we meet almost weekly to kind of discuss the by name list of veterans who are experiencing homelessness in the community. Different counties meet at different frequencies, but we're all at the same table. We're all on the same team. We're all working towards ending veteran homelessness in DC metro region. So it's a very collaborative approach. The numbers of homeless veterans in DC have gone down in the past year, and we are cautiously optimistic that they will stay down. There's a lot of concern once some of those eviction moratoriums are lifted, that there will be an influx, and so that's why we're also working to help prevent some of that homelessness early on, and definitely coordinating with the other veteran providers, but also the other just community providers.
And let me take a moment again. If you have any questions, please go ahead and put them in the chat. We do have time. I guess one, you alluded to, Emily, the potential uptick with the economic downturn. So some of the numbers we hear from other national organizations is potentially 45-50% increase in homelessness as a result of COVID and the economic downturn. Do we expect similar percentages amongst veterans? Is that higher, lower?
Yeah, so I actually just heard from John Kuhn yesterday about who's the director of SSVF, and so we have no reason to expect otherwise, but also so far on a national level, SSVF has not seen the uptick in prevention cases or homelessness that they anticipated. And so I think right now it's kind of a wait and see. And we're trying to get out ahead. We are being very intentional and collaborative in targeting areas of the city and the region that we anticipate are going to be most impacted by both the economic downturn, but also the folks who might be most vulnerable to complications from COVID-19. And so we are looking at, we have a screening system already in place, but we're looking at kind of refining that and making it a little bit more location specific to try to kind of mediate some of those barriers that people might have. So I think it's kind of a wait and see still, but we're trying to get in advance of it. Historically, you needed an eviction notice in order to receive services, prevention services. The VA has waived that requirement right now, so we're trying not to wait until there's the big surge.
Right. You had mentioned other providers that you work with and other organizations. How do we work with, or do we work with, I guess I'd call them fraternal organizations. It's probably not the right term, but places like the American Legion or VFW. I mean, how do we connect with them at all, or?
Yeah, we definitely do. So we keep a resource guide of all the different community organizations that provide different resources, and we break it down by different counties. And within that, when individuals are calling us for any of their needs, or we're working with case managers, or working with people, and they end up finding out that they may need a specific thing that maybe we can't do directly, but we can connect them with one of these community partners, we do that. So American Legion, I remember not too long ago, I want to say before the pandemic, we needed to reach out to American Legion to help us with a person that needed help getting a bus ticket to go to Tennessee. And VFW, there was a situation where there was someone who wasn't eligible for certain rental assistance. I remember in the past, and we reached out to them to see if they had any money at that time. So it was one of those things where if we see something that another agency kind of does, it would help the participant. We definitely do that engagement for them. Outreach does this. I know I've done this. Emily has done this too before. Case managers do this. If we can eliminate those barriers for any of the participants, we'll make those extra calls. We'll sit with that participant and see if there's anybody else who can help them with some of their needs.
We've also, American Legion in the past has, a couple of their efforts have provided move-in baskets for people. So kind of all those things that when you move in, you don't really think about until you're looking for it and you don't have it. So things like toilet paper, a shower curtain, pots and pans, paper towels, they've been really helpful in kind of providing some of those supplies.
I believe we have one question. If someone's asking if it's possible to get a copy of that community guide you had mentioned. I don't know if you have that in the form.
Yeah,
okay.
we can talk.
Okay. And Nikki, Emily has your email address because I just emailed it to her, so we can make that connection that way.
Thank you.
Sure. You had mentioned that the average age, I think you said, was 54 of folks that we're serving, but presumably there is an older cohort. How are we approaching people who want to age in place but may not? It may be difficult. I guess that's the diplomatic way to put that. I mean, how is that a concern amongst the folks we're serving? Are they getting older and unable to maintain their homes, but we're finding ways to help them, or is it really just not even an issue at this point?
It's an issue, and it continues to kind of grow. And it's something that DC is trying to think, as a system, is trying to think really critically about. There are not enough resources for folks, especially actually, so you mentioned aging in place, but there aren't enough resources in terms of like nursing homes or assisted living facilities that are that will accommodate a lot of the people that we serve in terms of income or in terms of potential substance use or medical compliance. So it's definitely something that the VA is looking at, and we're kind of working creatively with. We work with veterans on getting them connected with home health resources if that's what they need in order to maintain their housing. That might look like home health from the VA, although the hours provided by the VA are not as much as by some other organizations. So it might be also getting them connected with the right health insurance to then get a private home health aid. And we're also, we work pretty closely with the HUD-VASH team. So that's the VA's Permanent Supportive Housing Program. So that provides a housing choice voucher with intensive case management. So we can connect, it's through coordinated entry. So it's not just because we want someone to get a voucher, they get it, but we can work with the VA to kind of coordinate services in that way as well. But it's definitely an issue that's not going away, and it's something that we're working hard on.
Okay. Nikki is noting that her community guide is on her Pinterest site. And again, I think we can we've started that thread to start connections, because I think this is going to be a great resource back and forth. So thank you. What would you say are best ways for community members, like say the folks on this call, who might be able to support and help in your work?
Yeah, so I think definitely making sure that if you encounter a veteran experiencing homelessness, or you encounter a veteran who is at risk or who just needs kind of some direction about how to get connected to resources, to definitely reach out to us because we'd like to help bridge that gap. Right now, kind of volunteer opportunities are challenging. And so as much as we would love to have people be able to work directly with folks, we are really mindful of the risk factors that a lot of our participants are facing. I do think, I sound like a broken record here, but private funding is always really helpful. And so, you know, if anything that we can do to make a veteran's transition easier or to meet a need of a veteran is something that we always strive to do. And so the VA is a fantastic funder. They really listen to evidence-based practices, and they do leave a lot of discretion up to us. Except for, you know, a handful of things that often can make a difference for someone. And so I think that private funding is really key, and also just connecting people with us. So if you encounter a veteran, please reach out, because we definitely want to help them.
Very good. Want to do one last call for any questions folks may want to put in the chat before I give Emily, Jonathan, and Jean-Michel an opportunity to close out? I'm not seeing anything, so and perhaps that's the best way to do it. You know, let Emily and Jonathan, do you have closing thoughts you'd like to offer? And then I will turn to Jean-Michel to offer his own closing thoughts.
I just wanted to say thank you for taking the time out of your day to listen and to chat with us. I think that the more people that know about the services we provide, the better. And if, we are very committed to ending veteran homelessness, and we do that through the support of all of you. And so it has been amazing to see this program grow and change over the years, and it's just going to continue to grow and change. And I hope that you all stay tuned and try it along with us.
Great. Well, thank you both of you for taking the time to have this conversation today. Jean-Michel, is there any closing comments you would like to make?
Me unmute. Okay. I also want to thank you for joining us this afternoon. I want to thank you for your support. Daria, what the foundation does is tremendous. You've heard about all the extra expenses we have that VA doesn't cover, and they're part of the solution. Nikki, thank you for being on the call and reaching out. We love to make new contacts, so this is great. I want to thank our two leaders at Veterans, Emily and Jonathan, for sharing this afternoon. As you can tell, a lot of work goes into what we do to end veteran homelessness in DC Metro, and I'm so proud of the team. I have to say, I continue to be completely impressed with the leadership, with the staff, with the commitment. This is a team with high morale and that produces so much excellent work through the years, has produced so much excellent work. So I want to thank you for that. And Chris, thank you for facilitating so well, as usual.
Well, thank you for...
You're great. Again, thank you everybody for being with us this afternoon. We appreciate you very much. Have a great rest of the day.
Thank you, everyone. Have a great day. Take care.
Thank you.
Bye.